Today we're going to talk about follicular unit extraction, otherwise known as F.U.E. Now this is a relatively new technique in the hair restoration industry, and today we want to discuss both the advantages and the limitations of this. F.U.E. is really a different method of harvesting donor hair. With a traditional strip procedure, we would literally take out a strip of tissue, and that's what was used to be transplanted in the transplantation process. With F.U.E., we literally take the hair out follicle by follicle, one by one. The result is there's no linear scar. And some patients care a lot about that. So with an F.U.E. procedure, the scarring is distributed, it's far less visible. Another advantage of F.U.E. is patients tend to heal faster. They can return to their normal activities more quickly, get on with life. But F.U.E. is not for everybody. There are some limitations to it. And primary among those is that we typically see lower yield off of F.U.E. procedures. With a strip procedure, we talk about yields somewhere in the neighborhood of 95%. With an F.U.E. procedure, that might be 70–75%. Let me put those into real numbers for you. Let's assume a patient's doing a 2,000 graft procedure. With a strip technique, we would typically expect somewhere around 1,900 grafts to survive and grow. With an F.U.E. procedure, maybe that number is around 1,500 grafts surviving and growing. And so F.U.E. procedures result in a little bit lower yield. And as a result of that, we get lower density in the final result for certain patients. Now, that may or may not be an issue for a person. A person with modest loss can get perhaps either procedure is equally advantageous for them. But for a person who has very extensive loss, F.U.E. is going to result in a little bit lower density. So that may or may not be a trade-off worth taking to avoid the linear scar. We here at Samson offer both. So when you come in, we'll go over the benefits and the limitations of each procedure, whether it be follicular unit extraction or strip excision. We'll help you decide what's best in your particular case.